is with Pharmacy Technician Certification Board, PTCB, who many of you are certified with. And we're just happy that Zach made the trip here. He's living in Florida now. PTCB is based out of Washington, D.C. So please help me a very warm welcome, because we're really putting him on the spot to have him present an hour earlier. So I thank you.
All right, cool. Thank you. Can everybody hear me okay? Awesome. Well, good morning. Thanks for sitting in the front and bearing with that schedule change. I was talking with Judy before the presentation. This is my first in-person presentation since AAPT was held in person the last time in 2019. So if I'm rusty, please excuse me. It's much easier to present on Zoom in the comfort of your home, and you don't see the audience either falling asleep or, rolling their eyes at your topic. So this is also PTCB's first in-person meeting since early 2020 as well. So we're really happy to be here. Let's see. My disclosures: I work for PTCB. Other than that, no other conflicts. And then the AAPT Pharmacy Technician Code of Ethics here. Let's see, our learning objectives. So we'll describe advanced roles for pharmacy technicians. We'll also talk about current and existing roles for pharmacy technicians, then evaluate some of the current research and past research regarding those advanced pharmacy technician roles. I'll do a summary of the regulatory landscape that impacts pharmacy technicians' education, training, and responsibilities, and then review the development of advanced pharmacy technician credentials that are available. So first, we'll start off with a BLS statistic here. So there are about 422,300 pharmacy technicians working in the United States. And according to the BLS, help pharmacists dispense prescription medication to customers or health professionals. So that's a pretty vague definition, if you ask me. Some traditional technician roles, according to the BLS, collect information needed to fill prescription for customers or health professionals, measure, package, and label prescriptions. I won't read all the bullets to you. You're all pharmacy technicians. Is anybody here not currently working as a pharmacy technician? Do you work in education or other areas and just still interested, or are you working to become a pharmacy technician?
Just interested.
Cool. Excellent, excellent. How many people here are nationally certified? Excellent. That's awesome. And just by another show of hands, did you seek out national certification on your own, or was it because your state or your employer made it? So if it's required, raise your hand. And then if you just wanted to get certified to advance your career, keep your hand raised. That's awesome. That's cool. Does anybody want to add any other traditional roles after reviewing these bullets? Sure. Do you have an example?
I don't. I did see where they have other things that you can get into.
Yeah.
That's as far as I've got.
Oh, okay. So yeah, this is pretty typical day-to-day stuff for every pharmacy technician, no matter what practice setting you're in. But still, it's a little bit vague. We could probably put hundreds of sub-bullets underneath each and every one of these. Oh good, it shows up nice. So according to Pharmacy Workforce Center's 2019 National Pharmacist Workforce Survey, in comparison to 2004, there's been a dramatic increase in the past 15 years for the percentage of pharmacists performing healthcare-related services. So this slide really focuses on the pharmacist role and what advancing roles pharmacists have done in the past, well, since 2004. So you'll see here 13% in 2004 were spending time on medication therapy management, and 15% of their time, was on immunizations. So in 2019, immunizations went up all the way to 90%, and then MTM went up to 67%. So what does that mean for pharmacy technicians? That means distributive functions in the pharmacy all have to fall on somebody else, not another pharmacist. So in some cases, it might be another pharmacist, but as we all know, it's usually pharmacy technicians. So as pharmacist roles transition to include larger focus in direct patient care, that means that there's exciting new opportunities for pharmacy technicians to assume those expanded roles and responsibilities. And here is a really long list of some of those innovative pharmacy technician roles where pharmacy technicians are advancing. So again, I'm not going to read all the bullets here, but interactive, does anybody see anything that might be missing, or have you seen anything in your workplace where technicians are doing this? And keep in mind too that this is from a national standpoint. So your state may do something different, may not even allow some of this to happen as a pharmacy technician. But we'll talk a little bit later about the regulatory landscape where state boards of pharmacy are allowing the pharmacist to delegate responsibilities to the pharmacy technician, where, for example, there are certain states where a pharmacy technician is not permitted to take medication history, which some of us might find that kind of surprising, but that has to require the State Board of Pharmacy to put in new regulations for technicians to allow taking medication history. But that technician not being able to take medication history means they can't perform an innovative pharmacy technician role. And I know probably some of us in here are thinking taking somebody's medication history is not innovative. That's something that we do on a daily basis. But some state boards of pharmacy do classify that as a clinical role. And you can form your own opinion on that. But after reviewing some of these bullets, does anybody see anything that's missing, if you want to call it out?
Prior authorization.
Yeah.
Help with audits.
Oh yeah, very true. And of course, this is not an exhaustive list, it's not everything, just some bullets on the screen about innovative pharmacy technician roles. So now we'll get into some of the research and evidence, because of course, working in pharmacy, we really like numbers, and we really like statistics, we really like evidence. So we'll start with technician product verification. This used to be known as Tech. It still is in some places. This is generally defined as checking the work of other pharmacy personnel or automated systems, and like I said, also known as Tech. And studies have demonstrated that specially trained pharmacy technicians can perform this task as accurately as pharmacists, which we'll see in a few slides. Just by a show of hands, and I know it's early, does anybody currently work in a technician product verification role or doing Tech? Excellent. And then this is a little bit more of an ambitious question, but does anybody feel uncomfortable with doing technician product verification? Tech. Okay, excellent. So there was a pilot done in the state of Iowa. Is anybody here an Iowa pharmacy technician? It was over 18 months, and it was conducted in 7 community pharmacies. Sorry. That's weird. Sorry about that. So they checked rate of dispensing, errors, pharmacist work activities, and amount of reimbursed patient care services. And the program demonstrated that pharmacy technicians were accurate in checking refill prescriptions while helping pharmacists increase time in providing patient care services like we were talking about a few slides back. So one thing to point out here is technician product verification, or Tech, has actually been happening in the hospital setting since the late 1970s, which if you think about in pharmacy time, that's a long time ago. It's not really in the scope of things, but as we know, things in pharmacy move rather slowly, so that's a really long time ago. And we found this very interesting that a state was moving forward in implementing this in a community setting. So so that we can see this, right? It's a little bit small, but on the far right there, the pharmacist error and then the technician error detection rate, you'll see in the tertiary care institution that's checking unit dose envelopes, the technician error detection rate is actually 97%, which is higher than the pharmacist, which was really interesting. And of course, there's the Children's Hospital example here where they were both at 100%. The specialty pharmacy, I don't think that there was enough data in there to put what the error detection rate was. I think that's why it was left out here. But these are just 3 examples to what the Iowa Board of Pharmacy used to pilot in the community setting. So how does this help? This really provides pharmacy technicians with an opportunity for increased responsibility and career advancement. That's the most important to us as pharmacy technicians as we develop our careers and advance our careers as pharmacy technicians. But it really all comes down to that patient care and patient safety. It frees up the pharmacist's time to focus on direct patient care, as we were talking about earlier. And that leads to better patient outcomes, which is really all of our priorities. I think, let's see, is this next slide? Okay, the next slide is medication history. But back to technician product verification before we go on. I've seen evidence, or PTCB has seen evidence of using technician product verification as a career ladder for pharmacy technicians. Pharmacy technician career ladders really haven't been in existence in the community setting until rather recently. They have existed in a hospital setting, but not to a point where a pharmacy technician would want to advance to the next level because they choose to, but sometimes, oh, there's a management position open, I'm going to apply for it, that kind of thing. But I've seen where technician product verification has been, like there's a technician role that is specifically made for somebody in their pharmacy. So that either it's a shift supervisor or something like that fills that role, or they are just a sole technician product verification all the time. Similar to technician product verification is medication history. So this, of course, is obtaining medication history, and that's important because it's part of the med rec process, like we were talking about earlier. Collect all the information, document it, and then verify it with the patient. And then trained pharmacy technicians may be engaged in medication history collection in all of the settings of pharmacy. So 3 examples, of course, here: community pharmacy, emergency departments, and ambulatory care clinics. So there was a study conducted comparing nursing staff to pharmacy technicians with medication history. And this was to compare the accuracy of obtaining those medication histories between pharmacy technicians and the nursing staff. So the pharmacy technicians received on-site training by a pharmacy resident, which included how to properly obtain a medication history and updating the electronic medical record. There were a total number of 204 medication histories taken, 102 by pharmacy technicians and 102 by nurses. And the medication history discrepancies were classified into these 5 categories: drug omission, so that's leaving off a drug that a patient is currently taking; drug commissions, and that's adding a medication that the patient is not currently taking; incorrect or missing dose, incorrect or missing frequency, and then incorrect formulation. Does anybody have a guess on what the outcome of this study was? And if you know the results, don't vote. So yeah, let's see, did I put my water? Sorry, I was looking for my water. Oh, there it is, thank you. So there you'll see number of accurate medication histories by the pharmacy technician, 96, and 59 with the nursing. The number of discrepancies, this is incredible. If you remember from the previous slide, there were 102 medication histories taken, and there are 131 number of discrepancies by the nursing staff here. This slide is not to put nursing staff down at all. They obviously play an incredibly important role in the healthcare team, but what this demonstrates is that there might be somebody who's more trained and more qualified to take medication history, because there were only 7 discrepancies by the pharmacy technician staff. And then, of course, high impact discrepancies, 15 by nursing and only 1 by pharmacy technicians. Does this surprise anybody? No. It didn't really surprise me either. But this is the kind of evidence that state boards of pharmacy need to make those decisions to undo those regulations to not allow a pharmacy technician to make medication history. This is a very clear picture. Here's the same information, pretty much just in a pie chart. Drug omission, drug commission, incorrect dosing, incorrect frequency, and incorrect formulation. So the biggest chunk there was drug omissions, so leaving the medications off of the chart entirely. So what kind of qualities does a medication history technician have? Resourceful, inquisitive, compassion, and empathy. We all know, as pharmacy technicians, if you work in a community setting, these pretty much come naturally. If you work in a hospital setting, I worked previously to PTCB. I worked in a hospital setting, and I was first interested in a hospital setting because I didn't want to stand at a pharmacy counter and have patients yell at me. So that meant less patient interaction. However, I am not an introvert, and I need interaction a lot. And right as I was transitioning from the hospital that I worked in to PTCB, they were implementing medication history technician roles in the pharmacy. And they were actually replacing a pharmacist and a nurse. So that was 2 people who were doing medication history, and they were replacing it with a team of pharmacy technicians. And I was really a little bit jealous that I missed out on that opportunity because the medication history technician provides that interaction with the patient, especially if you're in the emergency room and you're just part of that on-the-go team all the time. And of course, that happens in other areas and other practice settings for pharmacy, but that was just something, an example. But compassion and empathy is really something that's important with everybody in the healthcare team. But as pharmacy technicians, I think that philosophically, we're always dependent on the pharmacist because everything that we do falls under their license. So I think that lends itself to pushing responsibility onto somebody with a higher license, things like that. And as pharmacy technicians, while we're compassionate and we're empathetic toward the patient, I think it really takes that interaction to help that, and where you kind of eliminate the need for pushing a patient off onto someone else because you're there for them and you're the first face they see, especially in the community setting. So it's really important that that patient rapport helps, I guess, enhance the medication history technician role a little bit. And like we said earlier, medication history is just part of our daily jobs sometimes as pharmacy technicians. So it's unfortunate that there are areas in the country that limit pharmacy technicians from performing medication history. All right, so here is a regulatory update. This actually is out of date as of probably last week. Things change all the time in pharmacy, so oftentimes slowly, but lately I've seen it change by the week, almost so much so that we can't keep up with it. But 46 states and DC require registration or licensure. This is now 21 states require certification. So while some states advance and put in more regulations, there are states out there that are removing regulations for technicians to work. And then of those 22 states that require certification to work, only 9 require you to maintain that certification. So thank you, everybody, for maintaining your certification. If you don't live in one of these 9 states or your employer doesn't require it, recertification is something, I don't want to take the test again. Does anybody else? 20 CE hours is not that much. Every 2 years, that's not a lot. So 26 states have a minimum age requirement. 30 states have a technician-pharmacist ratio, and that is probably changing. We'll talk about here in the next slide. 12 states have a pharmacy technician on their board of pharmacy, and there are 2 states that have 2 pharmacy technicians on their board of pharmacy. I started PTCB in 2013, and this number was 4. So in 8 years, we've advanced it that much. So that's really exciting because I've been mentioning state boards of pharmacy and regulators. It's really important for pharmacy technicians to be in those roles because we're making the decisions for our profession rather than somebody else. 21 states allow technician product verification, and this number may seem high. It's fewer in the community setting. So this number actually represents all practice settings, but this number may seem a little high, elevated, because the hospital setting has allowed technician product verification, or Tech, as I said, since the late 1970s. And there are 12 states that allow technician immunization administration, and this is outside of the COVID-19 immunization, the vaccinations. This is 12 specific states, and actually this number is now 14, that allow pharmacy technicians to do other vaccinations than COVID. Because as we know, all 50 states, Puerto Rico, Guam, DC, allow pharmacy technicians to administer the COVID vaccination if they're certified and trained, and excuse me, the pharmacist delegates that responsibility. Regarding immunization, I know there's probably been a lot of talk about that at the conference and in your day-to-day lives. Is anybody here performing immunizations? Excellent. Is anybody here interested in performing immunizations? Yeah, excellent. I got my vaccine from a pharmacy resident, and I begged them to give me a pharmacy technician, and they laughed at me. But I purposely wore my PTCB shirt into the pharmacy. All right, so here's where we'll do a regulatory update. And I'll go through some states as examples, and I'm going to read because I did not memorize all of this stuff, and as I said, it's changing all the time. So I'm gonna try to lump these together rather than going in alphabetical order. New Hampshire, Arizona, and California are all looking at advanced pharmacy technician roles as defined in the state board regulations. Nothing has been concrete and put in place yet in any of those states, but some, Arizona, California, New Hampshire specifically, are looking at licensing pharmacy technicians. So what does that mean? That, the state, it's up to the states to decide what that means, and they're all in the process of working this out, but some examples might mean maintaining your certification, earning a number of CE hours every year, of course a background check, that kind of thing. And that, of course, leads to the conversation of pharmacy technicians obtaining malpractice insurance, because they'll, responsibility will fall onto the pharmacy technician. Of course, it's always everybody on the healthcare team where malpractice falls, but the pharmacy technician where they're licensed may be liable. So that means taking a law exam in some place. It may mean taking a law exam, like as we know, pharmacists take law exams in order to be licensed, and now maybe a pharmacy technician would do that. No state has really implemented that. That's really important to put out there, because I don't want anybody to be scared by that. It's just an example of what might come for pharmacy technicians. There are so many states that are talking about pharmacy technicians performing immunizations that a new state gets added every day. Sometimes it goes away, sometimes it comes back. But because of the COVID-19 vaccination ruling, not really ruling, I don't like using that word, but where pharmacy technicians are allowed to administer the COVID-19 vaccination, and the pharmacist has delegated that responsibility. If you think back to one of the early slides, the percentage of time pharmacists spend on immunizations is so high. Where pharmacy technicians are able to do that technical task of administering the vaccine, it just further supports that pharmacist being able to do more direct patient care. So that means they get to spend more time counseling a patient. They get to spend more time verifying the accuracy of a new prescription. Because really, administering a vaccine is a technical task. Once you're trained and know how to do and where to place the syringe, it's relatively simple. I guess it's nerves and all that other stuff that comes with injecting somebody. But in response to the positivity of pharmacy technicians administering the COVID-19 vaccine, states have begun thinking, oh, we could do this in other places. And then, of course, like I said, 14 states now are allowing pharmacy technicians to do other immunizations. So Arkansas, Ohio, Illinois, Indiana, I'm not going to list all of them, but there are tons of states that are talking about it. If you think back to that last slide, I think I can go back, yes. The 46 states in DC that require registration or licensure, that means that there are still some states that require nothing of pharmacy technicians. That means no registration, no licensure, no certification requirement. So thankfully, there are best practices put in place by employers. Either the employer will require certification, either at the entry-level pharmacy technician or to advance the role. And oftentimes, even though 9 states require recertification, there are some states, some employers that require you to maintain that certification. So there are best practices in place, but some of those states, Hawaii, Wisconsin, Pennsylvania, and I think Delaware might be the last one that doesn't require certification, registration, or licensure. And some might say, oh, that means anybody can just walk into the pharmacy and be a pharmacy technician. Yes, that is true from the state board perspective, but the employer knows, who they're hiring. And oftentimes, like I said, that means certification, prior experience, things like that. But previous to 2019, states included that did not require anything were New York and Colorado. And Colorado just recently passed requiring registration and certification, which is a huge step because now it's almost like they did nothing for a long time for requiring pharmacy technicians to work in the state, and then all of a sudden now their certification, they're looking at education requirements around what it takes to become registered in the state, immunizations, like they almost launched themselves into current times, which is great. New York recently implemented certification requirement for health system only pharmacy technicians, which I find really interesting. A pharmacy technician is a pharmacy technician. It's, if you work in a community setting, sure, your day-to-day is different. But if you think back to our early slides, like the BLS, how they define what a pharmacy technician is and the roles that we do, it really doesn't differ. It just from practice setting that much. We're all still pharmacy technicians, so it's really interesting that they chose to go the route of requiring certification for hospital technicians. We have seen some evidence where the employer of community pharmacy technicians, independent and large chains alike, are like, we're not waiting for this. Like, it'll eventually come, so we're just going to have our pharmacy technicians get certified as well. What it doesn't do, though, is if you're working in a community pharmacy, if you're not registered with the state, because you're not required to, but you are certified, like, there are so many avenues that are dark and scary, especially when you talk about drug diversion and the opioid epidemic. I mean, there's so much we see in the news all the time. I don't know if anybody has Google alerts on for pharmacy technicians, but it's really interesting to see where pharmacy technicians get in trouble for their part in diversion. So it's interesting that state boards of pharmacy aren't interested in at least registering pharmacy technician, getting them on a list to say who's working in our state. As simple as that. And I'm happy to say that Pennsylvania was also a state that did not require anything of pharmacy technicians, but they are also quickly advancing. And I say this, but it's really difficult to say because of the tragedy of the last year and a half that we've all lived through, the entire world. But we've all not seen the pharmacy technician profession advance as quickly as it has. Either in your day-to-day, what your individual role is in the pharmacy, or from, like a philosophical viewpoint of what pharmacy technicians do in the pharmacy and how important pharmacy technicians are on the healthcare team. It's almost like the pharmacy profession as a whole had an aha moment that, oh, we all know we value pharmacy technicians, but wow, look what they actually can do. Look what we can do. It's awesome. It's great. So let's see. There are a few states, Indiana and Illinois and Virginia, are looking at requiring specialized education for pharmacy technicians in order to register with the state. And of course, PTCB has its own requirements, either education or work experience pathway, to become certified. But this would mean that the state says you have to complete some type of either accredited or recognized education in order to be registered with the state. So PTCB is actually working closely with the states that are looking at that and the accrediting bodies of pharmacy technicians. So there's ABHES and ASHP, ACPE do a joint venture for their accrediting of pharmacy technicians. That's the one that most people are familiar with, is ASHP. They began accrediting pharmacy technician programs in the 80s, so they've been around for quite some time. But ABHES does accredit like health science schools, and the pharmacy technician is obviously included in that. And the standards are really similar. So there are states that actually do require accredited education for pharmacy technicians. North Dakota has long required pharmacy technicians to complete an ASHP accredited training program prior to registering with the state. And then Louisiana most recently implemented that. And then Virginia even more recently is requiring it, I think, starting in 2022. I'm gonna move this mouse down a little bit. So I know I talked a little bit about licensure in the beginning, but I did want to point out, just because New Hampshire is probably the furthest along in the licensing discussion, I did put some notes in here. So they're drafting rules for a licensed advanced pharmacy technician. And so that person would be directly accountable to the Board of Pharmacy. So they would be licensed just like a pharmacist is, of course with different requirements. And then take on tasks such as product verification. So they would be called AAPT, and they would still work under the general supervision of a pharmacist, but would have much more direct oversight of the dispensing process. there's much more to come on this, and the board is actually going to, of course, going to be preparing for a public comment. So how does the public feel about this? Not just the general public, but how does the profession feel about this? You know, what does a pharmacy technician, if they meet the qualifications and the requirements put forth by the board, does the profession respond positively to having licensed advanced pharmacy technicians? And then with technician product verification specifically, New York is, I talked about their certification requirement for hospital technicians. They're also talking about technician product verification. There are some practice settings in New York in the hospital setting that actually don't even allow pharmacy technicians to do sterile compounding. So when we talk about states that are a little bit behind the times, and this is no slight to New York at all, or anybody who's working in the state of New York, but I would say that like New York was really, really far behind with what they allowed pharmacy technicians to do. Especially if you think about working in a hospital and having a pharmacist in the IV room all day. Does anybody here work in a hospital? Yeah, it's quite a few. Anybody in IVs? So yeah, also quite a few. I found it surprising when I first learned that pharmacists were in the IV room all day making IVs, just because that's what I did as a technician. Let's see. And then add Utah to the list of states, Washington and California, that are looking at technicians to do other immunizations. And then one state I do want to talk about is Idaho. We've been talking about it for a long time. Idaho has been there's been a spotlight on Idaho and the pharmacy profession for quite some time because they've kind of gone about it a little bit differently, where they eliminated all the regulations and started from scratch. So regulations, if you look at the rule books for the State Board of Pharmacy, can often be thousands of pages. And they basically took it down to 80 pages and said, leave it up to the licensed pharmacist who has the option to delegate responsibilities. So I'm really excited to see what's going to come out of this, because if you think back to the beginning of this innovative pharmacy technician roles slide, what does that mean for the profession of pharmacy technicians? Because I think, as we saw with the Iowa pilot, if one state's doing it and the profession catches wind that it's positive, just like that medication history study that was presented earlier, I think we'll see the profession swing in a way of, you know, recognizing pharmacy technician roles and allowing pharmacy technicians to do even more, especially under the delegation of a pharmacist, where that licensed advanced pharmacy technician isn't exactly on the horizon quite yet. So regarding all of the advanced roles of pharmacy technicians, there are a few credentials that can be earned. And this is where I'll talk a little bit about PTCB and what PTCB offers pharmacy technicians. So you're all probably familiar with Pharmacy Technician Certification Board. This is our mission and this is our vision. Again, I won't read it to you, but PTCB is the only nonprofit certification organization that's dedicated to pharmacy technicians and dedicated to advancing patient safety. Let's see. So a little bit about the PTCB certification numbers. Since 1995, which is when PTCB was founded, there have been 730,200 certified pharmacy technicians. This number does include the initial 2 states that started their own certification, which was Michigan and Illinois. So I always like to ask this, you never know, but I think in this audience there might be 1 or 2 people who were certified through the state of Michigan or the state of Illinois. Is anybody here? No. Maybe in other years, but they're definitely out there. So in 1993, PTCB wasn't even born yet, but Michigan and Illinois came together, and they have a really funny story of meeting at a pizza shop and thinking, hey, let's join our certification efforts because it's needed across the United States. And then ASHP, the American Society of Health System Pharmacists, and American Pharmacists Association, APHA, were like, yes, this is a wonderful thing. And then 2 years later, we had our first PTCB certification exam. There are currently 279,000, or I guess roughly 280,000 actively certified pharmacy technicians through PTCB. And these numbers are actually at the end of 2020. So we saw a dip in the active certified pharmacy technicians from 2020 for obvious reasons. Also, with the number of exams administered in 2020, this is about 20,000 less than we're used to. So I think just with things closing and stuff like that, we saw a dip in this. There are roughly 1,300 secure Pearson VUE testing centers, Pearson VUE professional testing centers, where the PTCE is offered, and it's administered and accepted in all 50 states, DC, Guam, and Puerto Rico. There are a couple Caribbean countries that adopt the US laws around pharmacy technicians. So PTCB is actually accepted in Turks and Caicos and a couple of the Caribbean islands. So now we'll talk a little bit about the credentials. There are 3 certifications that PTCB offers, and currently 6 certificates that are offered. So I want to distinguish between the 2 here. Certification earns an acronym after your name. It's earned after taking an exam, and it requires maintenance to maintain that certification. Maintenance is earning continuing education, and each of these vary in what continuing education is required. But the baseline is the certified pharmacy technician, and that's the CPhT credential. Then there's a specialized credential that can be earned for sterile compounding, and that's CSPT. If I go back to CPhT, I kind of skipped over that because I figure everybody's familiar with the CPhT requirements, but it's renewal every 2 years. The CSPT is renewal every year, and it requires 5 hours of sterile compounding specific CE that does count toward your CPhT. And then the newest is CPhT Advanced. So this is earned, I think I have a whole slide on this, so I'll talk about that in a second. But these 6 assessment-based certificate programs are certificates. So you complete a training program, or in some instances have work experience in the specialized areas, take an exam offered by PTCB, and you earn a certificate. Certificates differ in that they don't offer the acronym at the end of your name, and they don't require any kind of maintenance. So it's a one-shot. You take the exam and you earn that certificate. What's great here is you can bundle 4 of these certificates and get that CPhT Advance. So that's how you get CPhT Advance, if you have 3 years of work experience plus 4 of these. And I'll talk about that here in a second. Here are, so the 6 available are there on the left. So it's medication history, TPV, technician product verification, billing and reimbursement, hazardous drug management, controlled substance diversion prevention, and then immunization administration is the newest one. Immunization administration is a little bit different. It's unproctored. It's an open book exam, although it is there is a time limit, on when you can when you complete the exam, but it is, you can use your resources. Your resources can't be another human being, though. But the others are, they are an exam, just like the CPhT, and you can either take it online or in a Pearson VUE professional testing center. The upcoming assessment-based certificate programs are point-of-care testing. This bullet, my mistake, is supposed to say medication therapy management or medication management. We're currently working on the terminology there because medication management is a really big topic to tackle. So medication therapy management narrows it down a little bit, but when you throw the word therapy in there, it kind of has some clinical connotations to it. So we're trying to figure out the correct terminology on how to properly word that. Regulatory compliance and then supply chain management. So There's no real timeline for when these will come out, but point of care testing and medication management or medication therapy management, whatever it ends up being called, are the next two. I skipped over community health worker because we actually did a study with a whole bunch of external stakeholders, and I say a whole bunch, and that's really big to say, but employers, educators, currently working pharmacy technicians, and we asked, like, what are you actually interested in? And all the evidence pointed to community health worker becoming one of the next assessment-based certificates that can be earned until we went out and started to ask for volunteers to write questions and provide content for the exam. And I don't think we're there yet. So we've actually removed this one from our upcoming. And it's not removed forever. It's just tabled until we can get enough support for creating the assessment, because creating all of these does take a lot of time and energy and human power. Does anybody here, has anybody completed any of the assessment-based certificates? Excellent. Is anybody here CPhT advanced yet? Oh, excellent. That's great. Congratulations. It's new. It just came out, and there are roughly, I think we're at just under 600 CPhT advanced earned. So we'll see where that goes. But it's really exciting because you can bundle these assessment-based certificate programs, like I said, tack it onto your CPhT, and then you become CPhT advanced. So these are the requirements to earn your CPhT advanced credential. It's be an active PTCB CPhT, and then successfully complete at least 4 of the certificate programs. So at least 4. If you're interested in 5 or all 6, or when, in the future, if you want to take all 11, whatever, even more, they'll count. The caveat here is one must be in either technician product verification or medication history. So you get to choose between those two as your requirement for the assessment-based certificate. And then there is a work experience here, because you can't just go to school as a pharmacy technician and immediately become an advanced certified pharmacy technician, right? So you have to have 3 years of work experience in the past 8 years. There is an additional requirement regarding the continuing education, and that is 5 additional hours of CE for your CPhT advance. So it'd be 25 every 2 years. There's no extra cost to earn your CPhT advance, so there's no application. And there's no extra cost to renew either. It's the same as renewing your CPhT. All right. In which state was a pilot program initiated to determine the impact of Check Tech in 7 community pharmacies? Idaho, New Jersey, Iowa, Colorado, or Hawaii? Anybody remember? Yes. And then, which was the first state to allow pharmacy technicians to provide immunizations to patients? I don't think I actually mentioned this. Sorry, freebie. It was. I did talk about Idaho, but I forgot to mention that they were the first state to allow technicians to immunize. And then, which of the following states do not currently register or license pharmacy technicians? A is correct, Wisconsin and Hawaii. There is another question, but I do want to talk about this answer because I meant to discuss this when we were talking about states. Wisconsin is really interesting. Is anybody here a Wisconsin pharmacy technician? I really appreciate what they're doing because they don't regulate pharmacy technicians. There's no registration or license or certification required. And they've taken, employers have, specifically the University of Wisconsin, has said, that is great that you don't regulate pharmacy technicians, so we're going to run with this as far as we can. So they're piloting a bunch of things about what pharmacy technicians can do because nobody's telling them what they can't do, which is brilliant. So we'll see when they do move into regulations about what pharmacy technicians are in the state of Wisconsin. Then which of the following is required of an individual seeking to obtain the CPhT advanced credential? Have a minimum of 5 years work experience, be an active PTCB CPhT, earn 10 hours of CE annually, or successfully complete at least 5 assessment-based certificate programs, or none of the above. B is correct, yes. All right, and then I think we have like 10 minutes or so wait for a question, or, oh, I guess a little less than 10 minutes, but. And also my email is there if you don't want to ask questions out loud, but. Yes?
So I was looking into the CPhT advanced, and one of the requirements was, from what I saw, was a hospital component. It had to do with some of the tasks that are more so done in a hospital than a retail pharmacy. And so I reached out to PTCB to see how that, if another program can replace that, because I'm a retail technician and not a pharmacy tech, or a hospital technician.
Mhm.
Even though I am sterile product certified, double certified, to see if that would be in lieu of. I haven't heard, and so that's kind of preventing me from getting that credential. And I'm sure there are other retail technicians out there who may want that credential, but just can't get, because we don't work in a hospital.
Yeah.
Can't get past that requirement.
So there is no specific practice setting requirement for any of the assessment-based certificate programs. That being said, some of it does lend to a hospital setting. Like if you work in a state that allows technician product verification in the hospital setting only, your experience in technician product verification will own, if you're a retail technician, you're not going to have the experience for the technician product verification. Yeah.
Right, that's what I looked at, there's some barriers.
Yeah. Yeah.
As far as retail technicians being able to get to that point.
Yeah, that's why the technician product verification and medication history are the base requirements for CPhT advanced, because the medication history is a little, like the requirements to earn the medication history certificate is, there's a work experience pathway, so you can do that, and medication history is done by a community pharmacy technician.
But can't you take the course for the TPB too?
That, yes, yeah.
There's a course you can take.
Yeah, most of the assessment-based certificates do have an education requirement component to them, and what's great about that is there's a list of all of them on PTCB's website, but you earn CE as you take them, so it helps your CPhT recertification. So it's kind of like it's really balanced.
So you could still do it.
Yeah.
With the work experience, most of what we have here is either community pharmacy or hospital. Are there other experiences work experiences that also would apply to this, like working in a PBM, working at a veterinarian area?
Yeah. Yep. Yeah, PTCB looks at your work experience. Even if you're teaching pharmacy technicians, that counts. So yeah, that does count as work experience. Yeah.
So, my question is for those of us who are licensed, would our credentials necessarily change? Since if you're already certified and the credentials are CPhT, because I just got licensed, so now the license says registered pharmacy technician. It doesn't say certified or licensed certified pharmacy technician, but it changed to maybe registered pharmacy technician?
Not through PTCB. That would be all up to your state board. So there are 3 things there. There's licensure, there's registration, and there's certification. Each are used sometimes interchangeably, and they all mean something very different. So certification is an exam. Registration is meeting requirements to be registered on a list of pharmacy technicians, and then licensure is a little bit further with what kind of CEs required, or it's all really up to the state board. What state do you live in or work in? What is?
New York.
Oh, okay, excellent. Yeah. So your credentials through PTCB will not change. It's all based on the state board. Yeah.
I had a question about the slide that you were presenting on the TPB survey.
Mm-hmm.
It was interesting to see the error rates between the technician and the pharmacist, and I was wondering if you had any
On the technician product verification, with pharmacy technicians sometimes detecting more errors than the pharmacist. Yeah, that is very, very interesting research. Judy, are these slides going to be shared? They're shared online, right?
Yes.
Okay. The study is linked on that slide. At the bottom, it's really tiny up there when it's on there. But if you go in there, there's even more. So that little table that I had a snapshot of, there's actually a lot more rows to that, and it explains all of that. There are articles even beyond that where people have kind of inspected that. And it's all anecdotal after the data is presented like that. But if you think about it, if you're a pharmacy technician and you're participating in a pilot and you know that there's a magnifying glass on you, are you going to make sure that it's perfect? Which really, that's patient safety. The medication safety really should be that all the time. But we all know that the reality is if the spotlight is on us, we're going to be that much more, paying that much more attention to it. So they're really interesting. And I would really encourage everybody, if you're interested in reading more about the studies, either medication history or technician product verification, the resources are linked on the slide, so it's actually really interesting information.